Good afternoon. My name is Amy Berentes, and I am the Chief Nursing Officer for CGH. I've been here since September of this last year. And I was a nurse at CGH back in 1993 to 1997, and then did kind of a Midwest community tour to FHN and Mercy One in Dubuque, and then Clinton, where I spent about 13 years in various roles, leadership roles, from CNO to uh, interim CEO to COO, and now coming back full circle to be the CNO here at CGH in my own hometown community, which I'm really excited about. I love the fact of coming back home and being able to serve nurses in this community, and certainly on the other end of that, patients. So my role currently is to oversee nursing generally across both the clinics and the hospitals. So everywhere that nursing care is provided, that's really my role, is to make sure that that's going well and patients are being served in the manner in which they should be served. So, but today is not about me. Dr. Bird was so kind to turn over his Facebook Live so that we could talk about nurses and the important role that nurses play in the patient care in our community. And I just want to do a shout out to all of our CGH nurses during this week for the unique contributions that they provide to patient care and to our community. And we have, in fact, two fabulous nurses today that I want to participate in an interview to really just understand the nursing role and some of the aspects of care and care changes that have happened over the past several decades. So with that, I'm going to introduce two nurses, one, Mary Jean Derreberry and Stephanie Waller. Mary Jean is currently our Director of Clinical and Professional Development and Patient Experience. Mary Jean has been at CGH for just a little while, just about 50 years. So we're going to be very interested in hearing from Mary Jean and her role and her experience across the last half a century, really, if you think about it. And Stephanie Waller. Stephanie is a full-time nurse in our Digestive Health Center. And in her spare time, she is the chair of our Shared Governance Executive Committee and also the chair of our Recognition Committee and our DAISY coordinator. And also really has spearheaded the events of this week. So just really wanted to highlight both of these fine ladies. And starting with Mary Jean. Mary Jean, will you tell us a little bit about yourself and about your role here at CGH and what you've seen over this last 50 years in nursing?
Wow. Can I talk for an hour? I have a lot to say. So as Amy said, in June 22nd, I graduated with my RN 50 years ago and came to work at CGH July 30th. And this is the only place I've worked. This is my home. Back when I was in high school, the choice for girls was either to be a nurse or a teacher. And I love math. I was maybe going to be a math teacher, but I really love taking care of people. And so I decided to become a nurse. And really, I got the best of both worlds because we do teaching all the time. So most of my career was on the surgical unit, which I really, really loved. Bedside nursing for many, many years. And then I became the director. I just love taking care of patients. The rewards that you receive from your patients, the thank yous, the seeing how you make a difference in their recovery is just huge. I mean, I have every thank you note that I've received from a patient because those mean more than anything to me. I do plan to retire at the end of July. And so it's been fun, transitioning my role, patient experience. I took on that role 5 years ago, and that's very important to me. When we're in healthcare, patient experience is top, number one. Our CGH mission statement is delivering exceptional patient care by combining not only our outstanding skills, but our heartfelt compassion. And we are very caring and compassionate to the members of our community and taking care of them. And if I had to choose a profession all over again, I'd still be a nurse. I love what I do. I don't know that I can quit entirely, so I probably may come back at some point and help out because it's just in my blood. But a lot of changes over the years, and The one that I always tell the story about is cataract surgery. And many of you in the community have probably had your cataracts removed. Well, back when I first started, the patient had to be in the hospital for a week. They had to be on bed rest in their bed with sandbags on the side of their head, and we had to feed them. And they were here for a full week. Today, surgery takes 10 minutes and you're out of here 20 minutes after the procedure. So technology has changed tremendously over the last 50 years for the better, of course, for our patients, number one. So I love what I do, and we'll do it all over again.
Oh, Mary Jean, we are going to miss you so, and I know you're going to be back to help us. So I'm not going to say it's not going to be goodbye. It's going to be, we'll see it a little bit.
Yeah, in a little bit. Yes. I look forward to traveling and taking, my husband and I love to travel. So, but I definitely can serve in many roles, to help out any way I can.
Wonderful. I find it really interesting. I was in home care the other day attending one of their staff meetings, and Ann Nearcorn, who's one of our home nurses, said the same thing you did, Mary Jean. We were asking about how they like to be recognized. And Ann said, the only way I want recognition is I want my patients to be happy. And so I thought that said a lot in terms of, what we really desire is for our patients to walk out and be served well. So Stephanie.
We laugh with them, we cry with them. It's so rewarding.
Thank you, Mary Jean. And Stephanie, you are on the front lines on a daily basis, taking care of our Digestive Health Center patients, which are patients that are, do you want to explain that a little bit?
Sure. Well, good afternoon, everybody. I've worked in digestive health for several years now. I've liked everywhere I've worked, but this has probably been my very, very favorite. I love digestive health. A lot to learn there, and it's just a really wonderful opportunity. You get to meet your patient, you go through, your assessment, you learn a little bit more from them. We both have stories to tell each other. We get them safely through their procedures, and we recover them and do some teaching. In fact, it's a lot of teaching that we do in that department, and I really do enjoy that very much. I've been at CGH for 33 years now. Loved it all. So happy I came to work here 33 years ago. I did start at the clinic, and I was there for a few years, and then ended up coming right over here across the parking lot to CGH. And again, just so happy I made that change. I have not been a nurse that entire time, but almost probably 17 years now I have. So it was just a flash in time that happened. Seems like I just finished school, and here we are 17 years later. But I've appreciated every minute of it. I've learned so much. But in digestive health, what we do is we take patients through colonoscopies, through EGDs, which is short for, you'll know why we say EGD, for esophagogastroduodenoscopies. Those are what we call upper scopes. We would enter through the esophagus, and we go all the way to the small bowel, the beginning of the small bowel, and then colonoscopies. That's kind of self-explanatory. We go through the whole large colon. We can call it a colonoscopy if we have reached the beginning of the colon and we're able to see everything. Okay, throughout the colon. So we can say that we have seen the entire colon. We say a good colonoscopy, the way to have a good colonoscopy is to have a good prep. We want to make sure we've seen everything that we could see while we were in there. So if you think your nurse is awfully fixated on your stooling methods or how you did with the prep, yeah, we are kind of nosy in that way, but it is important for your safety and for you to have a good report. Okay, whether there's a polyp there or not, we want to know for sure, for certain. We want to be able to tell you for certain if you have any colon polyps. We do that. We also do some other procedures, not as many as we do, because we do a very large number of colonoscopies and EGDs every single day, 5 days a week. We're busy all day long, meeting the needs of our community. Colonoscopies, the range of age for that has changed. They're saying 45 is the new 50. So the guidelines have changed. So we've become especially busy. And yes, we want to get everybody who needs to have one turning that age for their colon screenings. We definitely want to be able to serve them. So we are trying very hard, and we're trying our very best to get everybody in a timely manner. So that's what we do in our department. So a lot going on. And I also want to say we have such a dedicated crew in the department. We have CNAs who work as GI techs. We have our nursing staff who admit patients, they recover patients, but also they see the patient through the colonoscopy and the EGDs very safely. Every nurse in the department is trained in moderate sedation. So they get that good medication that makes patients very comfortable and very, very happy that they haven't remembered one little thing. So that's the job of the nursing there. But yeah, our techs are just, I can't say enough about them. They have to know so much. They make certain that those scopes are squeaky clean and ready for the next patient. So they have to know a lot, and they do a lot for us.
Yeah, nursing is a team effort, isn't it?
It
We don't
definitely
do our
is.
job alone. And one of the things I think I heard you say, Stephanie, is you're moving the patient through this journey where they're either having an upper or a lower, as we call it,
Yes.
that we are really monitoring their comfort, right?
Yes,
And making sure that their vital signs are normal, and really this whole evaluation that we're doing throughout the process to make sure that that patient is having a good experience.
Yes, you're so right. Moderate sedation is all about the safety. It really is. Yeah. Patients don't receive a drop of medication until they are completely monitored, and the nurse is satisfied that the patient's ready to get started on their medication. So we take it very, very seriously.
Wonderful. And I was going to ask you about the screening criteria, and you offered it, Stephanie, so appreciate it. And remember, 45 and up is the new screening criteria. We want you to get in and get screened. And we know that the increase of colon cancer has gone up, particularly in young people. And so getting in at 45 is a really important
That's right.
community
Statistics
need.
did show that, yes, we need to move this down to 45 years of age. Okay, we want to be as successful as we can in finding cancers at the earliest possible moment. They're very, very treatable if they're caught very, very early.
Well, I think that probably all of you viewing here on Facebook Live today can see why these two fabulous ladies became nurses, and their caring and compassionate attitudes toward patient care. And that's why we celebrate Nurses Week, because nurses do have a really unique contribution to patient care. And Mary Jean, do you want to talk a little bit about how Nurses Week got started, and what the theme is this year for Nurses Week?
Absolutely. So Nurses Week is May 6th through May 12th. And May 12th, over the years, actually back in the early 50s, the lady that was the head of the U.S. Department of Health, Education, and Welfare sent a proclamation to President Eisenhower for him to sign, which he never did. And then they celebrated Nurses Week in late October the next year because it was the 100th anniversary of Florence Nightingale's involvement in the Crimean War and taking care of the soldiers. Then in the next couple decades, several things went to legislature, but nothing got signed. 1974, President Nixon did make a proclamation for Nurses Week, but it really wasn't until the early 90s that the American Nurses Association recommended, Nurses Week being May 6th through May 12th, so that we can celebrate a whole week of nurses' accomplishments. And Ronald Reagan signed a proclamation, and then it finally became permanent in 1994. The American Nurses Association sets a theme for every year, and this year's theme is You Make a Difference. And I'm to tell you, every single nurse makes a difference every day in a patient's life. So this is a week to honor all the different roles of nurses that we have and their positive impacts on our patients' lives.
Thank you, Mary Jean. It's probably why Gallup poll for the last couple of decades has named nursing as the most trusted profession, and something we're really proud of. And I think if you've been taken care of by a nurse, whether it be in the hospital or the clinic, and when I say nurse, I use that broadly, nurses, CNAs, MAs are all kind of within that spectrum of nursing care. You know that you can trust your nurses, and with very intimate information, sometimes confidential information, and they're going to take that, they're going to advocate for you, and they're going to make sure you're taken care of. So appreciate the background there. Stephanie has a unique role in Nurses Week this year. She is the chair of the recognition committee and really has facilitated the activities of this entire week. So Stephanie, can you tell us a little bit about how CGH is celebrating this unique week?
I'd love to. Okay, so yes, I was really excited about Nurses Week this year. Our committee, Awards Recognition and Wellbeing, has actually been planning since January for this 1 week of activities. Our ultimate goal was to celebrate all of our nurses and our nursing staff, and including the CNAs and the medical assistants. So we started the week off with a big thank you to all CGH employees. Thank you from the nursing staff with a breakfast, which was really well received. It was a lot of fun, took a lot of good pictures. We had a lot of nurses, nurse managers, period, and directors serving our employees hot breakfast. And I think it was probably, we provided for probably about 500 people, I think, all in one morning. So we didn't forget everybody who was on the off-site facilities, because CGH has many. We have many satellites, so we didn't forget them either. We couldn't bring them hot breakfast, but we did make sure they had breakfast muffins. So we started the week off, and I thought in a very high note, and I was really happy at how well received it was. We tried to have something going on every day. And what we do have going on every day is the nurses have been receiving little fun and interesting facts about nursing. It wasn't a quiz or anything, just things to know and things you might not have known, and just kind of, oh, hey, I never knew that, but kind of fun to keep that in your pocket. And then we've also been doing random kind of, if you think of door prizes throughout. Nobody had to do anything for the prizes. You just pick a name, and we're trying to do that throughout. That was, of course, throughout all of our facilities. Let's see. We also did gifts, as CGH does every year, does a Nurses Week gift. Being the committee that we are, where we're really concerned about a nurse's work and life balance and the nurse's well-being, we went for bento boxes this year to encourage nurses to be more involved in their meal prep and what they bring to work with them, be more conscious on what they're doing there as far as dietary intake. So it's just one of the, it's not the way we always go, but it just seems to be one of our particular goals this last year. So we did that, really enjoyed that. Very well received again, a lot of fun looking at them, very cute, of course. We did that. The departments provided meals for their nurses also one day this week, and that's always nice to get a free lunch or a free dinner, always appreciated. Also, we have the Jen Grove displaying her newer nurses, the projects that they've been working on. And if you don't mind, Mary Jean, I'll let you, if you want to talk about that, how that program later, how
Sure.
she does that with our newer nurses that are coming in. But that's very interesting. Did that, and of course, treats. We've had cupcakes going out every day this week, delicious, fresh, made by our previous CGH employee who June Purvis worked here many, many, many years, really, really dedicated to CGH. And even in her retirement, she continues to work, making cakes, maybe not as many as she used to, but for us, she'll
do it for us anytime we need her.
5 dozen cupcakes. So yeah, she's been a trooper, and we really appreciate her. And of course, yes, it's a delicious treat. Always welcome a cupcake. Okay. Lastly, I wanted to bring up this special video we did this year. It's something new, new to me anyway. We did a while back. I was reading up on Florence Nightingale, just kind of doing a little more investigating on her, in preparation for Nurses Week. And I read how in the UK they have done a passing of the lamp, just to honor Florence Nightingale. I don't know if they necessarily do it during Nurses Week, but to honor her. And as the founder of modern nursing, even though she was born in the 1800s, that's how far nursing has come. We decided, I just really, really liked this idea very, very much. It was very touching, and just reading about it just really meant a lot to me. So what we did was CGH hired us a videographer. She came in, and we visited all of our departments, and we actually passed the lamp, and we videotaped this, and you can see it on Facebook. It's a very good little video, and I hope that our viewers will take the time to watch it. It was really nice to see a lot of familiar faces throughout the hospital. It was nice to do this with our nurses. I really, really enjoyed it very, very much.
The Florence Nightingale, one of her nicknames is Lady of the Lamp, because of course back then, not having electricity, she would travel between the beds of the patients with a little lamp. And in my nursing graduation, I actually used that little lamp, when we had our nursing capping, but it was very moving. And please, if you haven't watched it, go to our CGH Facebook page.
To me, this really signifies when we're passing the lamp, we're passing our experience from one nurse to the next, from one department to the next, because we all help each other. It meant a lot to me to be able to pass this on, and to be able to show, we're passing. I mean, we have a lot of compassion for our patients, but we have compassion for our nurses too. Some days are more difficult than others, and it does take some understanding. We want to pass that on to the next. That yes, there are some bad days, but they're mostly good days.
Yeah.
So, Stephanie, we had a comment from one of our viewers that they said they watched the video and they loved it. And I would say the same. When I watched that video, as simple as it is to pass off the lamp, there was something absolutely beautiful about it, and the symbolism of it.
Yeah.
And you're right, the passing off of knowledge and compassion to each other. And, we just came off a pandemic.
Right.
And, the wellness piece of what you're talking about, Stephanie, has been really important during that time. And I know your group did a lot during the pandemic to support nursing. Do you want to talk just a little bit about that?
About committee?
Yes.
Okay. Yeah. Our committee, awards recognition and wellness. We always are wanting to recognize our nurses with awards, and just basically recognition for all that they do. Just a constant reminder. We want it to be a constant reminder that somebody sees you. We see what you're doing. It counts. And it really enhances another person's life, your coworkers and your patients and their families. We don't ever want to forget about them. The patient is always the family is always connected to that patient. So we're just always want to recognize that nurses, and their staff, or the nursing staff, the CNAs and the medical assistants, you do so much. So we just want to always remind you that we see you, everything you're doing. Part of that recognition is we also have a program called the DAISY program. And in that, excuse me for a moment. Sorry. I'm sorry. I'm so sorry. I was just getting a little dry.
No, we, that's all about that wellness, Stephanie. We still need to hydrate, right?
Right. So we have the DAISY program. Some people might already be familiar with it, and it has really, really grown in popularity. We've been working on this since 2018. Another facet of recognition for our nursing staff. Um, any nurse who has had an interaction with a patient where the patient felt that the nurse was especially helpful to them. Maybe the nurse went out of their way, maybe they did something on their own time or helped the family in a special way. It is very easy to nominate a nurse for the DAISY Award. You could do it online at the CGH homepage, or within the hospital or any of our facilities. We have paper brochures. Very, very simple write-up, does not take very long. We award one nurse quarterly, so 4 times a year. A blind committee looks at all the nominations, these written nominations, and we have certain criteria that they meet. And the committee does not know who the nurse is, but they read the story and they decide from there who will receive that award for the quarter. It's very nice recognition. We do a celebration. The nurse gets recognized within that department, and your coworkers are there, and they know you're very deserving of something like that. And when they hear the story, and they're like, yeah, that's that nurse. Yep. And I'm not going to say her, him or her.
Him or her.
We have both.
I'm so glad we have male nurses.
Wonderful.
More
It
and more.
really is. Yeah. So it's a very nice celebration. And again, a few tears here and there when those letters are read.
It really gets back to what makes a nurse satisfied. And that's the satisfaction of the people, the patients and the families that they take care of. And so when you read those stories back, they're typically from a patient or a family,
right,
or from a coworker that observed that
exactly.
care to a patient and family. So that's what makes nurses satisfied and happy. And so rewarding them for that, I think, is just I've been at those, Mary Jean, I know you've been, and they're just incredible to watch, them be read the story and just help them to celebrate what they do on a daily basis. So
yeah, a lot of tears.
Lots of tears.
Yeah, I've read some of those stories, and yes, it's hard to keep a dry eye.
Right. And if you don't mind, could I speak about the Sunshine Program at this time?
Absolutely, Stephanie. Go ahead.
All right. We also have a recognition program for our certified nursing assistants and the medical assistants, and that's called the Sunshine Award. And it works basically the same. Anybody can nominate a CNA or a medical assistant, either by paper brochure again, or online, which is, to me, is even simpler. So that can be done. Again, takes probably 5 minutes or less to share your story. But it means so much. Those the nominees get to read that story right away, and they of course are rewarded, the nominees, with a recognition pin that they can wear proudly on their badge. We hope they will anyway, but I haven't seen anybody who has not. But it's a nice piece of recognition to carry with you all day long while you're at work. And then we award them one with a blind committee, again, is awarded 4 times a year. And we do a celebration in the department again amongst their coworkers. It's a very happy time. It's a very happy time.
Wonderful.
So we realize we have to award our CNAs and our medical assistants also, along with nurses, because they support us so much. We can't do a lot of the things that we do as nurses without their support. They're there.
Part of our team.
It is a team.
It is. So yeah, we just keep coming back to teamwork.
So we had talked previously about Florence Nightingale and the fact that in the 1800s, she basically was it was the birth of nursing with Florence Nightingale and what she did. And a lot of it was self-taught at that time. Today, there's education that's associated with nurses at the bedside. And I wondered, Mary Jean, you now are in clinical and professional development. You are essentially part of the education department, if you will. Could you tell us a little bit about where education in nursing has come in these, and you've been in this for 50 years, not quite as long as Florence Nightingale.
No, not quite.
But you've seen this come a long way. Do you want to talk to us a little bit about education in nursing?
Yeah, I mean, and it's really, really advanced in the last several years. We employed one nurse educator who was responsible not only for the orientation, which, was involved that first week of orientation with new nurses, but also the ongoing education, planning skills labs and things like that. So it was before COVID, and we are very thankful for that because our nurse educators were a huge part of doing, day-to-day education of all the changes that we had with COVID. But we now have nurse educators in all of the specialty areas. And so we have a whole team that works together to provide education because it isn't just what you learn in school. I mean, you learn something new every day. And like I said, things have changed just with all this new technology. I still learn something. I learn something new every day. That's the fun thing about nursing is, that you're still learning and, advancing your degrees. The minimum requirement for an RN is an associate's degree. And we know that some bigger hospitals, like in the Chicago area, the minimum requirement is a bachelor's degree. And right now, we ask our associate degree nurses to get their bachelor's degree within 5 years of employment. And CGH has a great tuition reimbursement program to help pay for that. I was a diploma grad 50 years ago because that's pretty much all the schools that they had. And so those were all hospital-based, usually 3 years, got a lot of bedside training. I always thought, diploma nurses are the best. You don't need any degrees. Well, I found that wrong. So at the age of 50, I obtained my bachelor's degree and have been very, very proud of that. But there's master's degrees and actually doctorate. Amy just received her doctorate last year. And Stephanie named Jennifer Grobe, who will be taking over my position in nursing professional development. And she's been in education and she has her doctorate. And our emergency room director, Sarah Alvarez Brown, has her doctorate. So we're very proud for a small community to have all of that education. And we do skills lab, not only within the departments in the hospital, but we also do like house-wide skills lab, usually twice a year, for those skills that maybe all the nurses need to do. Things like chest tubes and the glucometer, that's the device that we check your blood sugar, and restraints. We don't like to use restraints, but unfortunately sometimes we have to, and there are safety guidelines for those. So it's very important that we cover that with our nurses and our CNAs. So I'm very pleased that we have what we have here to offer for education and to keep our nurses' skills up to date so that they can give our patients the safest and best care that we can.
Yeah, and Mary Jean, I'm so glad you mentioned the tuition assistance that CGH provides to all of its employees. Being new here, and I say new, that's relative. I can't really use the newbie card anymore, but I've been here for about 9 months. But coming here, I saw so many wonderful things, from the beauty of this facility to the programs for the community that are out there that our foundation supports. But one of the things that really I was shocked by was the amount of tuition reimbursement that CGH provides to its employees. So lots of wonderful things about CGH that I don't think a lot of people know, and just so grateful that we have such a wonderful community hospital here in Sterling, Illinois.
Amy, one thing I forgot, and I know Stephanie talked about this earlier, is our nurse residency program, which we haven't had. When I came here to work as a nurse, I worked with a nurse maybe a couple days and then I was on my own. And now, most new nurse orientation on the unit is usually 90 days, but that doesn't end there. We have a nurse residency program that is the first 12 months of their employment. And Jen Grobe leads that group. And, they work on maybe some specific skills. They talk about, confidence and conflict management and delegation and, all kinds of things to help, which you don't get to spend a lot of time on in your nursing school. And right now, they're working on their projects. They do a project every year, and this fall they'll do a presentation to all of the directors. And so that's what Stephanie was talking about, is they're posting some of their projects.
Yeah, it's really another one of the great benefits of becoming a nurse at CGH is the, ongoing education, and we really support the new graduates. I really appreciate the time, Mary Jean and Stephanie, that you've taken to just be here with us today and talk about nursing. Give me one word, maybe a couple, that you think, why is CGH so awesome?
Family, compassion, teamwork.
Yeah. I'm coming back to teamwork myself also. And it is like you have a second family. I got to shout out for nursing. I mean, if you're thinking of a new profession or a younger person not knowing for sure, check out nursing. There are so many directions you can go in nursing, so many specialties that you can work in. And when you work in nursing, you're working within that team. Your fellow nurses, they've got your back. You've got somebody to bounce ideas off of, somebody to get a second opinion from. Just the reliability, the dependability of your fellow nurse, the working together is just so rewarding to know that you're in a.
You're never alone.
You're not alone. Yeah, you're never alone. Anything you want to know is just a question away. It's a great profession to get into.
Absolutely.
Well, I don't want to miss the opportunity to also thank all of the other professions that we work with within healthcare.
Yeah.
Our physicians, radiology, lab, therapy, our
dietary. We got to have our good
our dietary staff, our environmental service.
Oh my! They were so important.
Operations.
They all have to be up and running. Yeah.
Yes, we have a whole village helping us to take care of patients, and those people are equally, helping us get better each and every day, and making sure that our patients are taken care of in an evidence-based way. And I can't forget the marketing department. They're why we're here today on Facebook Live. So
thank you. Yes,
appreciate it. One more shout out to nurses. Happy Nurses Week to all of the nurses across, not only in our community but across the country, and hopefully they understand and know how much they are appreciated. We see you, as Stephanie would say. We see you, and we so appreciate you.
Yes. Thank you. Yeah, Happy Nurses Week to everybody.
Yes.
Like
Happy Nurses Week.
It is the best profession I feel ever.
From the heart. Yeah.
All right, we'll wrap up this Facebook Live. And again, want to shout out to Dr. Bird for handing over his time today to nurses. And hopefully we'll be able to do something special for him. So thanks, everyone.
Thank you.
Thank you.